Alright, reporting from my parents' shed yet again. This video is going to be about what does HRT, also known as hormone replacement therapy, in this case for people that were born female at birth, assigned female at birth, what does testosterone do to this healthy female body? As someone who is no longer on T, but I was on T for 7 months, I have some of these long-lasting permanent side effects that I will be discussing in this video, and hopefully if you come across this, there's no need to hate on me or my story. This is simply just what I have discovered in my research that I've done in my own personal time about what tea can do, because unfortunately I don't believe I received all of this information before signing off on starting tea as a 19-year-old last year with severe mental health issues such as depression, anxiety, and even autism as a diagnosis already. But let's just jump into this video here. So hopefully you guys can see me. I think that's possibly a little bit better there. A little bit lighter. Okay, so HRT, testosterone in a healthy female body, assigned female at birth. Testosterone, when prescribed as hormone replacement therapy, also known as HRT, for cisgender women, or as part of gender-affirming hormone therapy for transgender men and non-binary individuals, is a powerful hormone that induces a range of physiological changes in a healthy female body. Example, one that is not clinically hypogonadal or testosterone deficient. The administration of exogenous testosterone is not typically considered replacement, but rather supraphysiological supplementation. This means the goal is to raise testosterone levels above the typical female range, which will produce significant and often permanent changes. Here is a breakdown of what HRT testosterone does to a healthy female body, categorized by the effects. Desired and common effects, therapeutic goals. For individuals seeking masculinization, these changes are the intended outcome of therapy. Physical and metabolic changes. Voice deepening. The vocal cords thicken, causing a permanent drop in vocal pitch. This is one of the most common and irreversible effects. Body fat redistribution. Fat shifts from a gynoid, pear-shaped around the hips and thighs, pattern to an android, apple-shaped around the abdomen pattern. The face may also appear leaner. Muscle mass and strength. There is a significant increase in lean muscle mass and strength, even without changes in exercise routine, due to testosterone's anabolic properties. Clitoral enlargement, or also known as clitoromegaly. The clitoris increases in size, which is often one of the first noticeable changes and is permanent. Skin and hair changes. Body and facial hair. Increased growth of terminal thick, dark hair on the face, chest, abdomen, arms, and legs. Okay. Male pattern baldness, a predisposition to hair loss at the temples and crown of the head. Similar to genetic baldness in men, this is also permanent. Skin texture. Skin becomes thicker and oilier, which can lead to acne. Pores may appear larger. Emotional and libidinal changes. Increased libido. A very common and often early effect is a significant increase in sex drive. Emotional shifts. Some individuals report changes in emotional expression, such as decreased frequency of crying or a different way of processing anger and frustration. This is highly individual and influenced by many factors. Menstrual and reproductive changes. Cessation of menstruation, also known as amenorrhea. Testosterone suppresses ovulation and the menstrual cycle. Periods typically stop within a few months of starting testosterone or HRT. This is a reversible effect if testosterone is stopped. Vaginal atrophy. The vaginal tissues may become drier, thinner, and less elastic, which can sometimes lead to discomfort or pain during sexual intercourse, also known as dyspareunia. Infertility. Testosterone therapy causes infertility, which is often permanent, even after discontinuation. It is considered a form of contraception, but not a guaranteed one. Egg freezing is recommended for those who may want genetic children in the future, before they start the tea, which I did not. Potential side effects and health considerations. These are effects that are monitored closely by healthcare providers as they can pose health risks. And here's another thing I'm going to mention. These were not really monitored too closely. It's just come back every 3 months. We'll check your blood, but that's essentially as much as it went for me. But anyways, let's get into some of these monitored closely by some healthcare providers. First up, we have polycythemia. This is one of the most significant risks. Testosterone stimulates the production of red blood cells, which can thicken the blood. If the hematocrit level becomes too high, it increases the risk of blood clots, a stroke, and heart attack. This requires regular blood monitoring and may involve therapeutic blood donation, also known as phlebotomy. Cardiovascular impact. Testosterone can alter cholesterol levels, typically by lowering good HDL cholesterol and sometimes raising bad LDL cholesterol. It may also slightly increase blood pressure. Long-term cardiovascular risk is an area of ongoing study. Metabolic effects. It can induce insulin resistance, which requires monitoring, especially for individuals with a predisposition to type 2 diabetes. Mental health. While many experience improved mental health due to reduced gender dysphoria, the hormonal adjustment period can sometimes cause mood swings, increased irritability, or anxiety. Sleep apnea. Testosterone can worsen or potentially trigger sleep apnea, a condition where breathing stops and starts during sleep. Monitoring and management. Administering testosterone to a healthy female body is a serious medical decision that requires careful and ongoing management. Informed consent. A thorough discussion of all potential effects, both desired and adverse, is essential before starting. Regular blood work, monitoring testosterone levels, hemoglobin, lipid panels, and liver enzymes is crucial for safety. Dosage and administration. The method, also known as the testosterone gel, testosterone injection, or testosterone patch, and dose are tailored to the individual to achieve the desired level of masculinization while minimizing health risks. Summary. In a healthy female body, exogenous HRT testosterone acts as a powerful masculinizing agent. It systematically shifts the body's secondary sexual characteristics towards a more masculine phenotype, affecting voice, fat, muscle, hair, and reproductive function. While it can be profoundly affirming for those seeking these changes, it is not without significant and often permanent effects, as well as health risks that require lifelong medical supervision. It is not a therapy to be undertaken lightly and should always be managed by a qualified healthcare professional, which in my case, it has not been managed by any healthcare professionals, and I've just been labeled a guinea pig like most other detransitioners. So I'm excited to hear what you guys have to say or think in the comments down below, and thank you for watching the video.